All right. Good evening. Thanks for joining us. My name is Danae Abra. I'm the Healthcare Innovation Supervisor with Well Ahead. Please note that your lines are muted to prevent background noise, but feel free to enter any questions into the Q&A box at any time, and we will have a little pause for any questions from a previous session. So if you already have them in your mind, you can go ahead and enter them, and we'll get to those in just a couple minutes. Today's webinar is the 8th in our Telehealth in Practice webinar series, presented by Dr. Ted Hudspeth, and today we're talking about value metrics in telemedicine. Again, the slides and the recording of the session will be on our website, along with the recordings and slides from all the previous sessions at walpen.org/telehealth. And we are working on several pre-recorded sessions, which will be on the website in the coming months. As a reminder, this is funded in part by Texas Telehealth Resource Center, which is a HRSA-funded program at Texas Tech University designed to provide technical assistance and resources to telehealth programs in Louisiana and Texas. And Well Ahead serves as the support representative on behalf of Louisiana providers. And Texas is part of the National Consortium of Telehealth Resource Centers, and they have a ton of resources there. So you can go dig through their website at telehealthresourcecenters.org. And with that, I will hand off to Dr. Hudspeth.
Well, hello, everyone. Welcome back. This is, as Danae said, our 8th video on trying to build a telehealth program in your practice. So I hope that you look at some of the other ones that we've already done on the website, and we actually will end up having 16 different presentations over time. So I'd like for you to enter any questions from any of our previous sessions if you have any at this time. And as we go along, if you do have some, please pop them into the chat, and Danae will let us know that you have a question, and we'll do that. Do we have any at this point?
Nothing right now.
All right. Well, as we go along, if you guys have some questions, go ahead and let me know. Otherwise, we'll move along. So as we said, today we are talking about value. And someone that I esteem, Warren Buffett, said, price is what you pay and value is what you get. That's pretty easy. Warren Buffett has a history of finding great values in investing and then offloading them when they're a much higher price. That's how he's got to be one of the richest men in the world. So for us, however, we provide a value in our clinics and to our patients. And some people provide more value than others. And I think it bears a really big thing for us to go through and figure out, first of all, what does someone value and when they see us as a provider. So as far as an overview of the things that we're going to talk about today, first is what is value in healthcare? And then talk about the industry and consumer changes, because I truly believe that over time, what people perceive as value has really changed, and it's been changing pretty rapidly recently. So I want to go through some of those topics. And then I'm going to look at drivers of patients' perception of value, patient outcomes and how those relate, and then how all of that goes into provider resilience. You see, I truly believe that we as providers gain some value from our patients. And when you look at it like that, it really turns the tables on how you see your visits, how you conduct your visits, how you interact with people and your patients, your staff. When you truly feel like you gain value from being there, and I'm not just talking about a paycheck, okay? So we'll go through all of that. And then I'm going to go through a few nuts and bolts here on hypertension and diabetes workflows and how I use them to drive some of the value-driven metrics that we look at, those just how do you get the blood pressure to goal or the sugars to goal, okay? So let's talk about value to start with. So when you start looking at the definition of value, there are really 3 different angles to look at it. There's an absolute value, a relative value, and then a perceived value. So I'm going to use the Mona Lisa as an example. So if you look at the absolute value of the Mona Lisa, it's a canvas and some paint, okay? Not a whole lot of value there, but that is the absolute value of what is actually there. The relative value of that would be if you start comparing it to other, older paintings that were made by, some of the greats of painters. But then when you start thinking about perceived value, people perceive the Mona Lisa as one of the greatest paintings that was ever painted. So because of that perception, people will pay more for that, obviously, but they hold it in higher regard. And so you have to think about that perceived value as part of what we are delivering when we work with anyone. And I'm not just even talking about patients. I'm talking about the perceived value of your staff working with you, et cetera. So all of these things I'm going to be talking about, when I learned these things, I felt like they had huge implications in the rest of my life, not just with my patients. So these things are very near and dear to my heart and get kind of touchy-feely, but I really feel like they're important for kind of a life lesson kind of thing. So I hope it helps you out when we go through these. So specifically, what is value in healthcare itself? I truly believe that value, or the main value, is when we improve someone's health outcomes, okay? And that may not be just their blood pressure reading, okay? Not everyone goes to the doctor to be cured. Sometimes people go to have their voice heard or their concerns allayed, or there are many things that people come to you for, and their perception of the value that you provide is directly related to that. And the outcomes of that is really where your value lies, okay? I don't feel like it's just when you reduce costs in business, or if you are improving a workflow. There are other values that you provide. So in truth here, what I'm going to be doing today is I'm going to try to focus on the root of what drives value to patients and providers themselves, to us as providers. What drives the value in us doing what we do in our daily work? And so those metrics, I think, are the most important things that we're going to talk about and hopefully give you some insight into. So as far as the value that can be achieved for patients through telemedicine, because we're talking about telemedicine, they can achieve some value of convenience, their time, their transportation, and location. They can be anywhere and do a telemedicine visit and get their problem taken care of. They often will have greater satisfaction through this method and better quality, because I feel like being able to connect with people more often or break down some barriers to them seeing you and getting the care that they need will end up giving you better quality, okay? In addition, there are reduced costs that can be achieved through this and greater access, okay? So the main thing I'm going to be focusing on, though, is the satisfaction and the better quality piece. I just think that's real important here. And as far as providers, what do we get out of these telemedicine visits? What kind of value can we achieve? Well, one is that we can acquire new patients that might not ever have been able to see us because of geography. They can now see us through telemedicine. And also we can retain our current patients. If you are able to see your patient when it's not convenient for them to get to you physically, if they can get to you through a telemedicine visit, then they don't have to seek their care elsewhere. So retention is a big thing. And that's obviously a big deal for rural and underserved patients, people who work for a living and they can't get to you physically during their work time or leisure time. And of course, we've gone through this huge pandemic. So in disaster situations, Most of us kept our clinics open by performing telemedicine back when the pandemic started last year. It also affords us a job flexibility. So for instance, I know one physician right now who has practiced over 30 years, and he is at an age where he wanted to retire, but he still wanted to be here. Okay. He was very conflicted on what he wanted to do. And so he started investing his time in building his telemedicine practice. So this physician recently bought a fifth wheeler, and he is actually going to go out on the road. He's going to start traveling. And guess what? He's going to be able to see his telemedicine practice every day, or the days that he wants to. So think about that. It gives you geography freedom, geolocation freedom for yourself, can add new payment mechanisms for your practice, and lower some of your overhead costs in what you do in your practice. You can also really gear things towards the appropriate level of service. You know, not everything needs to be seen in your clinic. And instead of taking up one of your slots there, which often is an extended appointment, you can take care of more acute things in shorter appointment time slots to be able to make it better for your practice. You can harness all these new technologies that we have, like being able to check people's blood pressures or follow the blood pressures or the glucoses and all that kind of stuff through these telemedicine portals. And it also gives an increased opportunity to connect with people where their needs are. So, you know, sometimes it's hard for people to actually, if they're an invalid, et cetera, you know, with a telemedicine visit, you can actually service them and of course, retain them in your practice. Okay. So the big thing here though, is that everything is changing. I know you all know that. And the next set of slides that I'm going to be presenting, I would like to credit someone who I hold in high esteem. It's Dr. Chantel Loriot, who is actually an expert, in my opinion, in empathy training and patient experience. And she shared some of these slides with me, so I wanted to credit her on these. I learned from her several years back when I started working with our own patient experience teams. And I just have found them to be so valuable to help us understand where the industry is going. So first of all, we are all under a lot of change structures right now. We have new payment models that many of us are under now. There have been payment cuts from most insurances and the governments, et cetera. There are new delivery options. You know, we're talking about one of them now, doing telemedicine. So we're trying to be at the forefront of this. There are employer benefit changes. So employees actually have different benefit structures. They have more out-of-pocket expenses up front in their insurance plans. So they often delay care and seek other ways to obtain the care than your office maybe. There are ways for patients to be able to seek out information now online. You know, most of us have online profiles, and those can be looked at, and those drive people's decisions. And of course, the higher out-of-pocket costs that they have because of their insurance changes, that certainly has changed people's minds about how they make decisions about their health care. So as these deductibles have been going up, people are really having increased options of how they decide to receive their care. And they are more engaged in figuring out how they're going to get that care, and they make decisions based on value, their perceived value of what they're going to get, okay? And that makes sense. So I'm going to ask each one of you to think about yourself and how do you decide where you're going to do business? You know, right now for me, if I'm going to be in a big city and I'm going to go out, I'm going to look at OpenTable and figure out what's around me and what has an opening. If I'm going on a trip, I might go through TripAdvisor. And of course, if I'm going to figure out which restaurant's best and has a lot of people liking it, I'm going to go to Yelp. So all of these are online places where I can go and figure out where I'm going to get some value for my planned purchase, right? So the other thing for me that goes into making this decision is, I want to go to a good place, all right? So I want you to think about these concepts. First of all, we expect for a business that we go to have safety and quality. You expect that. That's a bare, just bottom line, you expect it. If it's a hotel, you expect your room to be clean, correct? If it's an airline, you expect to arrive safely, expect to not crash, right? And if it's a fast food place, you expect your food to be cooked. Another thing you expect is to have access. You expect to be able to get a hotel room when and where you want it, right? You expect, if it's an airline, that you could change your flight if you needed to. And if it is a fast food restaurant, you don't want to have to wait in line forever, okay? So when you think about your practice, think about, do you hit all these benchmarks that you expect in other businesses? So the flip side of that is, think about what would set some of these businesses apart, okay? It's really when it comes down to customer experience, that is really what sets things apart. So if you were at a hotel, you would think about the staff was very attentive and planned every detail. Well, that would be best of class, correct? And if you were in an airline, you would think about the attendants being cheerful and funny. And then if it were a fast food restaurant, you would think about the cashier greeting you, always saying, "My pleasure," and saying thank you. So when you think about places in your mind, I bet some things come to mind, right? Because these best in class places for me would be like the Ritz-Carlton, Southwest Airlines, and Chick-fil-A, okay, in each of these categories. So when you think about your own practice, where do you hit on all of these targets, right? You want to be best in class. And the thing that will set you apart from anyone else is when you hit on the customer experience, okay? So let's talk about patients now. How do patients decide where to receive their care? Well, this is what's changing in the world now, because they have health grades. They have rate MDs, and they have ZocDoc. On all of these, patients can go to these and look to see, how do other people experience your care? So I'm going to click on health grades. I'm going to show you mine right now. This is me. I don't know if you've ever gone to your own health grades site, but on health grades, you can have a little bio about yourself. You can set it up so the patient can actually click to call or book online. They have locations. This shows where you are. And down below, these are all the ratings. Just like you rate a restaurant, patients are rating you. And as you can see here, like, it has things about you, patients' experiences with you, just like if you were going to go to a restaurant. Okay. So let's see. Get back to where I was. Can you see back on the presentation, Danae?
Yes.
Perfect. All right. So now I'm going to ask you, for a patient, what makes you best in class? Like we were thinking about, the Ritz-Carlton or Southwest Airlines. It's the experience that they have with you. And from a patient perspective, that truly is where the value mark comes in, okay? And that's the patient experience. It's just the bottom line. If they have a great experience, they're going to seek you out in the future. And what makes this such a bigger deal in the telemedicine world, in my opinion, is that, people are no longer landlocked. In the past, especially in the rural areas, if someone is in the rural area, if you're the only game in town, so to speak, then they're going to probably go to you just because you're closer. But in the changing world right now, people can really see anyone anywhere. I mean, they can click a button and see someone miles and miles away. So it makes a lot of sense for us to work on the experience part of your practice, not only just for telemedicine, but for your practice itself, okay? Your regular in-house clientele. So I think that today's presentation on kind of driving those metrics is important for all of you. So perception does become reality sometimes for people. And this was a study in the past that was done, and they looked at people's or patients' perception of their care. And in the study, they showed people place more importance on their doctor's interpersonal skills than their medical judgment or experience. And doctors' failings in these areas are the overwhelming factor that drives patients to switch doctors. So that's a very important statement. You know, another thing I saw was a study recently where they showed that the number one thing that drove patients' decision to make an appointment was the time that they could get an appointment. Number 6 on their list was the quality of care that they received. That's amazing to a lot of people when they hear that for the first time, but that's what it shows. Another thing I wanted to bring up was this is kind of old news too. You know, specialized knowledge versus human engineering, so to speak. You know, when this was published back in 1936, How to Win Friends and Influence People. And back then, they even showed that 15% of success was based on your specialized knowledge. And 85% of the skill of the human connection with people is really what drove people's decisions to kind of do business with other people, okay? And this has really become there's a new term going around about this, and it's called emotional intelligence. So emotional intelligence is basically your ability as a person to understand others' emotions, connect with those emotions, make a connection with them, and go forward from there. That be the root of your, I guess, your relationship, you know, being able to make that connection and understand them where they are, for who they are and what they are, and not have judgment. Okay. So that rings true in a lot of other things that we're looking at today as a society. And I still, again, why I feel this is so important for us to understand and to work on, because we all can do better. When you're looking at emotional intelligence and using empathy to drive the perception of value, these are very key skills in our ability to connect with people. It's that ability to use empathy in our connection with others. And why it's important for us as providers is because it definitely drives your effectiveness with your patients. It drives your efficiencies with people, and it drives values. Bottom line is it drives values, and that's why I included it here. I'll show you a slide in a minute that actually is a study showing how all of this has been shown to drive people's metrics, their value metrics. And the flip side of that is it drives my fulfillment as a provider. I'll share some stories about that in a minute, but this investing in this piece of your daily life will improve your fulfillment and your purpose in what you're doing. And that is so important for us, especially in these times when we're all pushed to the limit of everything that we're doing. We're stretched very thin. We're having to do more in shorter periods of time with less. And at the end of the day, investing in this will help you get through all of that. So engagement and activation. So think about it. Engaging people and having them have some action, be activated to do something. there's no question that there's a connection between people's satisfaction, their experience that they have with you, and then their engagement to do what you said. So patient satisfaction increases the experience that the people have, and it engages them to implement your recommendations, and that has been shown to lead to better outcomes. And obviously at the root of that, better value. That's what we're talking about here, okay? And this came out of a study some years ago. Dr. Judith Hibbard had done a study looking at a tool where they surveyed people with their level of engagement and wanted to see what would happen with that. And the results, they actually scored them from a PAM, patient activated measure, on a scale of 1 to 4. And the results showed that a highly activated patient with a PAM-4 score had a more favorable clinical outcome and cost less to manage than a poorly activated cohort, okay? So again, if you are engaging in or becoming involved in any kind of a value-based contract with insurers to care for patients, then this is a must for you, because when you do that, you actually have to engage patients to take your medicines, get their A1Cs checked, get their blood pressures to goal. And we can't do that only with medicines. We've got to engage them with diet, exercise, etc. And if you don't have an engaged patient doing these things, then they're not going to reach their targets, and then you're going to be at risk for that. And so that's a big deal. Another study has shown that for every 10-point decrease in HCAP scores, for those of you who don't know what HCAP scores are, this is basically when patients receive questionnaires, they actually, it rates their experience with you, okay? So for every 10-point decrease in this, there was worsening adherence to medications, okay? And compared with patients who have higher ratings, these other patients who actually had lower provider ratings, they actually had less, they weren't using their medicines as much. They didn't reach their A1Cs, they didn't reach their blood pressure targets, etc. So another study, this is specific with diabetes. They showed that when higher empathy was used in visits, that patients' control of their sugars were better than those where empathy scores were lower, and patients were more out of control with both their A1Cs and their lipids. So again, employing empathy in your visits can have better outcomes in patients' engagement. So I'm going to talk a little bit about my personal experience. I have been in practice for 27 years, and I have a panel of over 3,000 patients. I'm very driven on value metrics, have been so for years. I'm the lead physician of my clinic, where I work with 5 other physicians and 2 nurse practitioners. I'm the medical director of informatics for Ochsner Baton Rouge. I supervise APPs, as I said. I'm currently in a master's program and a small town practice doctor. So as most of you who are in a small town, you know how it is. You're never off the clock. You're always on the clock. If you're at Walmart, you're at a ball game, you're on the clock. So, you are a provider of care to people, and you are part of people's lives. And that's probably why most of us like being in a small town. I love being a big fish in a small pond, okay? I love that part of my practice. But this provides challenges for us. We are never off, so to speak, and that leads to a risk of burnout. There's no question about it. And I tell you, in my 27 years of practice, I've been to that point sometimes myself. And every single time that I was to that point, I don't know why I did it and have done this all these years, but I just did it. I reinvested in that connection I got from patients. I guess some physician along the way had imparted to me that wisdom to reinvest in, as I call it, that thing. I call it that thing. It's that non-financial payment you get for being a provider. And you know what I'm talking about. And by just dumb luck, I had done this all these years. And every time I invested in that thing, it brought me out of my funk. Okay, I'll put it like that. I just felt like that kind of kept me going. And it wasn't until actually some years, about 4 years ago, that I started working with our own patient engagement team and started working with other physicians and started studying all of this. And I learned that what I had been doing was actually a pretty cool thing and a pretty good thing and something that we recommend to people now. And it has names and everything. Again, I was doing it all these years and really didn't know what I was doing, but it worked for me. And so that's why I try to espouse this to others. And, you know, at this point in our country, over 50% of primary care providers are really to the point of burnout. And these have been borne out in some recent, very large studies that have been done on with polls to primary care doctors. And because of my experience, I have always felt that, you know, providers connecting with their patients, that thing that we get, I mean, it's intimately tied to each other. And investing in these experiences that we get, you know, when we give of ourselves to others, we get in return. And reconnecting with people really gives you value as much as it gives value to patients. It really drives you. And for me, how this came about for me was I had gotten in with all of the patient engagement team, my institution, and I got asked to go to the Press Ganey conference in Florida. I just could never imagine that I would do something like that. But I went to that and, you know, I thought I had this little thing in my head that I was doing and connecting my experience with a patient's experience. It's kind of like if mama isn't happy, nobody's happy. Well, for me, if I felt like if I make myself happy in these visits, then patients would be happy too. I thought I had kind of a corner on the market. Well, I went to this conference and there were probably 5,000 or 6,000 people at this conference. And wouldn't you know it, there were all kind of lectures on this subject. So I didn't have any corner on the market. I was probably late to the table, but it was refreshing to me to see a lot of other people were really employing this in their practices and their systems. So it was exciting to me to see that. And actually at that conference, they had this little construct that I'm going to show you. It was a model for deconstructing burnout. So think about the things that you do in your day. I'm going to go at the bottom of this balance beam here. If you look at the left side, there are some inherent rewards that you get in your day for being a provider. There are things you expect and that you are just kind of guaranteed. And that's, you know, we make a great salary. We have good stature in our communities. Most of us are in very good working conditions. I mean, those are things that you expect. And those are inherent rewards that keep us going. There are also some inherent stressors. These are things we expect. When we became a provider, we knew we would be working with sick and dying people, okay? We knew we would be managing complex problems. We'd have to keep up with education and all those kinds of things. We know that, all right? But there are some added stressors that tilt this little balance the wrong way. And some of those can be all of the time constraints that we are under currently. You know, filling out insurance forms, I loathe those, okay? All of the redundant paperwork that we have to do, the EMR challenges that we have now and having to type and do all of those kinds of things with a computer. And then for those of us who work or own their own practices, all of a sudden you're dealing with staffing issues and billing issues and all those kinds of things that have nothing to do with taking care of patients. So you can see how that would really tip the scale. Well, what I learned from this conference was that the added rewards that we can add in our day that help tip the scales are things like satisfaction in helping people, connecting with others, and learning new things. You know, when you invest in those types of things, it adds to your resilience. And resilience is really the fulcrum of whether you are going to become an engaged provider or whether you're going to be going through burnout. And that's the question mark, is how many of these positive things do you put in your day to be able to tip those scales in favor of engagement? Because that's truly where your success, not only as a productive provider, but also a success in your mind, in your life, that's really what tips the scales. Because I know any of you who have gone through burnout, you know how this doesn't just stop at your clinic door when you walk out. This extends into the rest of your life and your family's life. So that's why it is so important, in my opinion, to focus on some of these things that you can do in your day to kind of keep you going and go for the long haul. You know, most of us are planning on doing this for the rest of our life. So trying to invest in those things that you can change now and make better for the future, I think is very well worth it. So again, I think the reason all of this is a success is because that thing, so to speak, that I talked about earlier leads to your purpose. You know, when each of us went into medical school or nurse practitioner school, we had in our mind's eye what we wanted to become. Nobody wanted to become, you know, someone who doesn't care about people, rushes through visits, et cetera, and doesn't connect with people. So every now and then you have to think about, you consciously need to think about what is your purpose and how can you connect to it. Actually, one thing that really helped me a lot when I was about to leave to go to college, I was wanting to go to medical school, and there was a physician in our town that came to meet with me. And he said, you know, in his experience going through all of those years of college, medical school, residency, et cetera, there is no way when you are taken through all of those life experiences that it can't change you. You're going to be different if you don't do some specific things. And he asked me to do this for him. He said, think about what you want to be right now when you grow up. All right. And he said, every month, at the end of the month, sit down for 5 minutes and think about the really big things that have happened to you in your life over that last month and reset yourself. For instance, you know, you may have been on some rotations in medical school that were not very nice. You know, a lot of medical training programs in the old days used to teach through fear, et cetera. And during those times, I mean, at the end of that, I would think about bad behaviors that I learned from maybe some other folks, and I'd think about good behaviors. And I would try to get rid of those bad ones and go to the good ones. And at the end of all those years, 11 years of training, I feel like I was able to maintain some semblance of what I wanted to become, you know? So think about that it's never too late to start that. You know what you wanted to do when you started this process, and you can get to that and get to that purpose. So some drivers of value, I'm going to go through a summary of these things. Patients have choices and they seek value, just like you do when you go out to do business. Choices are driven by previous previous experiences. So if someone had a great experience with you, they're going to come to your office again. If it's a telemedicine visit, they're going to click your button again and schedule an appointment and get into a telemedicine visit. Experiencers are driven by your connection. So your previous connection with someone is going to drive that experience. And connection is driven when providers use caring communication with patients. And, I truly believe it comes down to two things. People want to feel like you know them, and they want to feel like you care. And it's through some of these processes that you can do that. People know that you care and are more engaged when your emotional intelligence and your use of empathy is high. So think about that. And engagement drives patient activation and compliance. So compliance with your therapies. And compliance drives better outcomes and therefore better value for your value metrics that you report to the insurers or the government or whoever it is. And then providers gain purpose when they successfully employ these techniques with patients. And purpose drives resilience, and resilience reduces burnout. So this is a big circle. I thought about making this as one big circle, but there wasn't enough room on the PowerPoint. It's a big circle, guys. And I just love that investing in one thing has value in other areas. It's just a really neat thing to me. So I love that perception of things. So there are two big diseases that value matters these days. Most people are getting tracked on this right now. And I'm going to talk a little bit about hypertension and diabetes value-driven care via telemedicine. So this is the scenario. A patient's blood pressure or glucose is out of control and a change is made in their therapy. We need a plan to follow up. Now, we've talked about this in previous presentations, but I just wanted to go through it again because I find that when I use this type of a telemedicine visit, that it really allows me to drive some connection with people, okay? So think about this. I change their medicine and I use a script. I say, I usually follow up on this type of problem in 2 weeks. I now offer this to be done through our telemedicine service, which is like doing a FaceTime visit. You can do this from anywhere and don't have to come to my office. And if you want to do this, I can have my nurse arrange this for you. Okay, so that's the script you can use. And then you send in an order for a blood pressure and pulse and glucose entry into your patient portal if you have that. Or you can have patients just start writing down their blood pressures and their glucoses because you'll be able to see that when you do their telemedicine visit. And think about that now. I mean, right now you may be seeing a patient in follow-up and they come in and you just check their pressure. Well, you have one value that you're basically making a decision on. Doesn't it make sense that 2 weeks of values is better in their home situation than just one value when they had to fight traffic, wait on you for 30 minutes, and then see you for 10 minutes in a room? I mean, it seems to me that that's a better way of doing things. And so I do that for both diabetes and hypertension. I schedule them for a 2-week visit, and then I see them in 2 weeks and evaluate and manage their problem based on that 2 weeks of data. So evaluation and management, that's how we make our living, right? And in that process, most of the time in a telemedicine visit, people are there for a problem. They usually don't have a lot of the problems that are bring all of that to the table, so to speak, like they do in a clinic visit. So during that time, I'm able to spend some quality time with them discussing their diet and their exercise and their weight management, all of which have a big implication on these values that we're trying to achieve with their blood pressures and pulses. Okay. So for me, I feel like this has reduced some of the barriers to care. You know, patients can't always get off of work and come a second time in 2 weeks to see me. So this drives down some of those barriers. I actually get reimbursed for some of these visits. Historically, if someone sent me, 2 weeks of values that ends up in my my bin to answer, should I change my blood pressure medicine? Well, I don't have all those other opportunities of counseling, et cetera, that I do when I do a visit. This also helps my patients to get to goal. And I did want to share with you one story about one of my patients who was a diabetic, or is a diabetic. And again, historically, before I had telemedicine, I would have patients send me their values, and then I'd make a decision on the spreadsheet that they sent me. And then my nurses would call them with information of whatever I wanted them to change. So I had this one patient follow up for the diabetes through this method. And afterwards, my nurse had to call her and talk to her about something else. And she told my nurse, she said, because my nurse had asked, actually, what did you think about your telemedicine visit? She said, when Dr. Hudspeth wanted to see me and talk to me about my sugars and all of those other things that he did, I feel like he really cared about me. Now, isn't that what we all want people to say about us? Felt like I cared about her, and I did. And so again, it all came about because I was doing a telemedicine program, and it just allowed me one other opportunity to touch her life and touch her disease and try to make it better. So I'm going to put a plug in here. I've given you basically all of the thoughts about why you need to do all of these things, okay? I haven't given you some of the nuts and bolts of actually how to implement it, okay? We have 4 on-demand videos that we are going to be doing as part of this series. One of our on-demand presentations is called Best Practices and Caring Communication. It is the sister presentation to this one. It is the nuts and bolts of how do you actually do that? How do you actually connect with someone? What do you say? And especially, how do you do all of that in a telemedicine visit? Well, you've got to watch that presentation, okay? We already have it actually written out and all that. We haven't videoed it yet, but I will probably be doing that within the next week. So once we're done with this particular presentation in the PowerPoint, we'll actually put the link right here on this page so you can be linked to that other presentation. So I urge you to watch that, because the things that I'm going to teach you through that are things that I have employed in my practice, and it is what has allowed me to tip that scale back the other way, to where I feel like I have less burnout and really have enjoyed my practice so much more by employing those techniques. So I will leave you with a quote here. People will not always remember what you say. They may not remember all you do, but they will always remember the way you made them feel. And that is the truth. Think about other people who have impacted your life also. It's the way they made you feel when you were around them. And we all want to have that effect on other people in our daily lives, not just in our offices. And all of these techniques are ways to be able to do that. So I will close now and ask for folks to ask any questions. Remember that we have all of these resources on all of these pages in our presentation, and for you to be able to employ in your practice. And remember that you can always look on the main website, thewalpen.org/telehealth, to be able to see this and all of the other presentations. And of course, you can connect with us through any of these links. So we'll open it for questions now. Does anyone have any?
Thanks, Dr. Hudspeth. We actually do have a question in the Q&A box
Okay.
Related to when you were looking at the health grades page. They said, we've had a patient pop approach us to handle online ratings through health grades, et cetera. Did your office engage someone to monitor these ratings?
Yes. I highly advise it.
And it sounds like Patient Pop was the company that approached them. I don't know of any others. That's not something I'm very familiar with.
I don't know that company. I honestly don't know who does that for us, but I do know that we have that. Yeah. I think that's important to do. You know, I mean, health grades is very popular. I can't tell you how many people come to my office that say, yeah, I found you, you know, online and I looked you up beforehand. Many of you know I do endoscopy 2 full days a week. You know, patients are getting scheduled for a colonoscopy. They don't know me from Adam. And so what do you, I mean, I work in Hammond, but I'm doing colonoscopies in Baton Rouge, and most of the population that I do is over there. They don't know me from anybody. What do you think they're going to do? People look that stuff up. I mean, I do. If I want to find out something, what am I going to do? I'm going to Google it. So patients do this, and more power to them, because they're educating themselves about their health care. And I just gave you all the reasons of why they're doing that. And it's a good thing. You know, I feel like an educated patient is going to be a healthier patient. They're more engaged in their care. And that's what we're trying to achieve here. It's part of what you provide with your value. So you need to probably look at, you know, where are you popping up online? Search yourself online and see which ones of these you are already on, because, you know, health grades, they've already looked you up and put you out there. Whether you go to claim it or not, that's your decision. But I recommend you go claim your site, so to speak, and then put information about yourself that you know, you want people to know in those spots, so that people can find out about you more. You know, that's what I recommend.
Yeah, and I will say, if I have to go see a new provider, I'd always go to health grades.
Yeah.
And if I have, you know, I have a hospital that I typically go to, but if I have to go to a different hospital for any reason, I hospitalcompare.gov, you know, because that's the one that I'm aware of. And people do, you know, research.
Yeah.
And,
Well, if
the
someone else
reviews.
was always footing the bill, maybe you wouldn't care about it. But, you know, everyone has to make their healthcare dollars stretch, and you want to be with a good person.
All right, I'm not seeing any other questions in the Q&A box, but we'll give it just another minute to see if any come through. And while we're waiting on that, I did want to just let everyone know this is Tracy's last session with us today as part of the series. She is retiring on May 3rd. So we're very sad to see her go. We're going to miss her a lot, but I'm very excited for her to move into retirement phase of her life. As you can see, she's got her beach background already. She's ready to move on. So
Already on vacation. I just want to know, did you put on any sunscreen to have that background today?
I almost have to wear sunscreen with that.
Yes, indeed.
Well, I've been privileged and honored to work in SOAR and be able to do exactly, I think, what you were talking about today, supporting people and making that connection with them to help them get through what they're trying to accomplish. In this case, advancing rural health. So this was right on target, and I appreciate this actually being the last telemedicine session, because I really appreciate that.
Well, you will have to make sure that you click on the next session that we're going to be doing on the on-demand on how to make it work.
Yes, will do.
All right, I'm not seeing any other questions, so we can go ahead and wrap up unless you have any other last comments before we close for today.
The only comment is make sure that you check that next session, because it really is a great one. Again, I will be using some of these slides from Dr. Lorio that I talked about. She's just, I hold her in such high regard, and the content is just really phenomenal. So come on back.
If you have not viewed earlier sessions, there is an incredible amount of information in those sessions, and a lot of links for information on telemedicine visits, and there's so much information there that is on that Walpin website that he has linked in this presentation. So please take the time and consider going to that for further review.
All right, thanks guys. And with that, we will wrap up for today. Thanks everyone for joining us. You know, that all of our content is on walpin.org/telehealth. That's our website there. Our next session is May 6th, Thursday at 5:30 p.m. And we're going to be talking about telemedicine potential related to disparities in care. So that's going to be a really great session. After you exit, you'll get a survey question in your internet browser about topics for future education. So please enter any telehealth related topics that you'd like to see covered in some future education. And as always, please feel free to reach out to us at any time with questions, and thank you and have a great night.
Good night.